Okay, tonight's discussion D deals with complications after heart surgery for memory. So we're going to discuss that tonight for C. So please join me for tonight's discussion C. Here we go. Older age and certain health risks make cognitive recovery after heart surgery slower and more complicated. Advanced age, frailty, and pre-existing conditions increase the likelihood of lingering memory or thinking problems, while uh, prote- protective factors like um, education, social activity, and good health habits can improve resilience. Why age matters. Uh, Degenerative brain changes. Natural aging reduces brain reserve, making older adults more vulnerable to anesthesia and surgical stress. Higher complica- higher complication rates. About one quarter of patients over 75 experience significant cognitive decline after major surgery, and some may suffer permanent impairment. Slower recovery. Older adults often take longer to regain baseline cognitive function, with the def- deflects, defects persisting for months in some cases. Pre-existing cognitive impairment. Patients with mild memory issues before surgery are more likely to worsen afterward. Chronic diseases, hypertension, diabetes, coronary artery disease, kidney disease, and prior stroke increase the risk by promoting inflammation and vascular fragility, frailty, and multimorbidity. Frail patients with multiple health problems face higher rates of delirium, prolonged hospital stays, and delayed recovery. Surgical complexity. Longer operations use a cardiopulmonary bypass, and greater anesthesia exposure raises the chance of postoperative cognitive dysfunction. Lifestyle and education. Lower educational uh, att- uh, attainment and limited mental stimulation reduce cognitive reserve, while active social and mental engagement protect against decline. Rehabilitation and protective strategies. cognitive training, structured exercises, puzzles, and memory tasks can help retrain attention and recall. Physical activity, cardiac rehab, and gentle exercise improve circulation and brain health. Emerging therapies, techniques like transcranial stimulation, acupuncture, and even virtual reality are being studied for recovery support. Social and caregiver support, family involvement, and social stimulation reduce isolation and aid in recovery. Bottom line, age itself is a strong predictor of slower recovery, but risk is magnified by frailty, chronic disease, and pre-existing cognitive decline. Protective factors, education, social activity, healthy lifestyle, and structured rehab can buffer against these risks. For older adults, especially those over 75, protective planning with surgeons, anesthesiologists, and rehabilitation teams is essential to minimize long-term cognitive complications. Would you like me to outline specific pre-surgery steps to reduce the risk or post-surgery rehabilitation strategies tailored for older adults? Okay, guys, that is your C for this afternoon. I'll be back on with these shortly. Give me a bit to put that together for you, and I'll be back on with that shortly. For now, Gator Wellness, take care, folks.